In infants, signs like oral thrush, pneumonia in first year should make you think of HIV. HIV is human immunodeficiency virus. It's a virus that attacks the immune system, especially a type of white blood cells called CD4 T cells, helper T cells. And those help your body fight infections. And so if those are damaged, it's going to be pretty bad. So what you need to know is the virus type is retrovirus. It's an RNA virus that uses reverse transcriptase. Its main target is CD4 cells, CD4 positive T cells, weakens your immune defenses. Transmission, blood, sex, needles, birth, vertical transmission, breastfeeding, leads to AIDS. HIV enters your body, infects your CD4 T positive cells, uses reverse transcriptase to turn its RNA to DNA, and it inserts your DNA into your cells, making more of the virus, and so it's just going to keep killing CD4 positive. So without treatment, you're going to become vulnerable to other opportunistic infections like PCP pneumonia, thrush, tuberculosis, CMV, toxoplasmosis, etc. The list goes on and on. Can it be treated? Yes, there's no cure, but antiretroviral therapy will stop the virus from multiplying, raise your CD4 counts, and lower the viral load to be undetectable, and it helps people live normal, healthy lives. What about babies? Well, if a pregnant woman has HIV, then she can pass it on to her baby during pregnancy. So let's check this out. We got a newborn baby with severe infections is found to have HIV. What would have prevented this? The answer: antiretroviral therapy during pregnancy. Think of your immune system as like an army, and CD4 are the generals, right? HIV wipes out the generals so the body's defenses fall apart. ART, antiretroviral therapy, protects the generals, helps them stay strong. That's basically what's happening here. So if a pregnant woman has HIV, she can pass it on during pregnancy, birth, or breastfeeding. And if she takes ART, the risk drops from 35% to less than 2%. So definitely have to watch out for that if the mom has HIV. So risk factors, she's like a drug user, breastfeeding, and so the transmission is going to go way down if you can properly use antiretroviral therapy. So 3 steps to remember this question, never miss it again. 1, maternal HIV infection leads to infant immunodeficiency. If you got oral thrush, interstitial pneumonia, and the little baby severe lymphopenia, that's going to be HIV infections, okay? So recognize that. 2, ARTS, antiretroviral therapy. It reduces transmission. You just got to know that. 3, lack of prenatal interventions directly correlates with the fetal outcomes. So she probably was neglectful. She did not do her prenatal interventions, and that could have resisted the mother-to-child transmission. Some other answers that you might see: prenatal vitamins, that'd be like to prevent your neural tube defects. Vaccines, there's no vaccine to exist right now. Interferon alpha treats hepatitis B or hairy cell leukemia, not for HIV prevention. It's not going to be a live attenuated vaccine. There's no live or killed for HIV. Toxoid vaccines are used to prevent diseases like tetanus, but they have no role in preventing from HIV. Viral component vaccines, there's no viral component vaccine for HIV either. So it's going to be an enzyme inhibitor drug is going to be the answer to this. That'll reduce the vertical transmission from the mother. Antiviral therapy is going to help out to induce your enzyme inhibitors and reduce the risk from 35 to like 2%. Okay, hopefully this is helpful. If it was, like and subscribe.